Welcome to the Deep Dive. We dig into complex topics, pull out the key insights, and maybe, just maybe, share a few surprising facts, hopefully with a bit of humor along the way. Today we're plunging into a world where technology and our actual biology are, well, getting tangled up. It's a future that's kind of already here. And for a lot of people, it maybe started hitting home with a story that sounds like it's straight out of some sci-fi thriller. Picture this: a house fire, quiet neighborhood, arson investigation. The homeowner, Ross Compton, he has what seems like a solid alibi. Says he was asleep, woke up to the fire, grabbed a few things, got out fast. Sounds straightforward, right? But then comes this incredible twist. The star witness against him, his own pacemaker. It really makes you ask, what happens when the tech designed to save your life could also, potentially, be used against you?
That is a really chilling thought, isn't it? I mean, the police, in that specific case, they actually got a warrant to pull the data from Compton's pacemaker. We're talking his heart activity, minute by minute, before the fire, during, after, all of it. Then a cardiologist looked at this super personal health data and basically concluded it was, and I quote, highly improbable Compton could have moved as fast or carried as much stuff as he claimed, not with the heart rate and activity levels the pacemaker recorded.
Wow. So just like that, this life-saving medical device becomes, what? A digital witness. A potential legal headache.
Exactly. It instantly transformed it. Compton pleaded not guilty, obviously. His lawyer argued using the data violated doctor-patient privilege, his constitutional rights, privacy, self-incrimination, the whole 9 yards. But the case tragically never really got resolved. Compton passed away at 62. So that critical legal precedent is just kind of hanging there. It's just such a vivid example of how this deeply personal health data collected by devices we think are purely medical can suddenly jump tracks, raise these profound legal, ethical questions about privacy, even digital self-incrimination.
And a really bizarre story, that preview. It's our way into today's deep dive. The Internet of Bodies. The IoB. Now, most of us know about the Internet of Things, right? IoT, your smart thermostat, maybe a connected fridge, everyday objects online. But IoB, that takes the idea and, grafts it right onto us. Creates this deep, intimate link between tech and the human body.
Precisely. And the RAND Corporation. They've got a pretty clear definition that helps us grasp just how intimate this connection is. They say an IoB device is anything with software or computing power that talks to an internet-connected device or network. And this is the crucial part. It either collects person-generated health or biometric data, or it can actually alter the human body's function. So we're not just talking passive tracking here. We're talking devices with direct, often continuous access to our most personal biological info. It's a whole new ballgame for data.
Okay, so our mission for this deep dive is clear. We're here to unpack the huge potential, but also the surprising risks of this Internet of Bodies. And related tech, too, like medical IoT, human body digital twins, all that cutting-edge stuff. We'll explore how these innovations are genuinely changing healthcare, for the better in many ways. But we also have to confront the complex challenges they bring up, especially around cybersecurity, data privacy, and those really tricky ethical questions that the Ross Compton case threw into such sharp relief.
Right. And to help you navigate this, because it's evolving so fast, we'll structure it. We'll start by defining the tech, what it actually is. Then we'll pivot to the benefits, the really remarkable things it can do in healthcare. From there, though, we have to delve into the risks. The cyber attacks, the privacy breaches, the ethical tightropes, the sort of alarming underbelly, if you will. And finally, we'll look at solutions, the governance frameworks, the security measures, what we need to do to navigate this new frontier responsibly.
And we've drawn on some really rich source material for this. We've gone through detailed academic studies on medical IoT, digital twins, combed through industry reports on, actual medical device hacking, ransomware attacks, and scary stuff, and looked at insightful ethical analyses from top research groups like RAND and ECRI. It's fascinating, sometimes a bit unsettling, but definitely eye-opening stuff. This deep dive into the fascinating, yet complex, world of connected health is brought to you by partners who are right there at the forefront, understanding and tackling these exact challenges. We're really grateful for the support of www.devicerisk.health, www.hipasecurity.health, and www.digitaltwinrisk.health.
Yeah, their work really underscores how vital it is to approach the security and privacy side of these groundbreaking technologies thoughtfully, from the actual devices themselves all the way to the massive amounts of data they generate. It highlights the practical need for securing this whole new digital health ecosystem.
Okay, let's really unpack this core idea. The Internet of Bodies, we said it's like an evolution from the Internet of Things, IoT. But what's the actual difference? And, why does that difference matter so much? When we talk IoT, we're thinking smart thermostat, right? learns your schedule, or maybe that web-enabled fridge that tells you you're out of milk. Smart light bulbs that connect everyday objects to the internet. IoB, though, that's uniquely focused on devices that directly interact with or monitor the human body. That feels like a huge leap.
It is a huge leap because it fundamentally changes the stakes involved. As one of our sources, NTT, explains it, IoB isn't just connecting devices, it's merging technology, data analytics, and even behavioral science to predict and sometimes even influence human behavior. They kind of see it in two ways. There's the Internet of Bodies, the physical connection, and then there's the Internet of Behavior, which is more about turning our actions, our habits into data, ostensibly to improve quality of life, convenience, comfort. Think about your smartwatch, if you have one. It's not just counting steps, is it? It's automatically logging your activity history, distance walked, path taken, time of day. It converts all that into data without you doing anything manually. This easy visualization, it gives you chances to reflect on your day, maybe even based on your search history online. It moves way beyond just sensing the environment around you. It's actively sensing and interpreting you.
That is incredibly powerful. And it leads us to the sheer range of IoB devices that are already out there coming really fast. It's not just like medical implants anymore.
Not at all. The RAND source breaks them down into a few categories, and the variety is, frankly, pretty stunning. First up, you've got the wearable or external devices. These are probably the most common way people encounter IoB right now. Smartwatches, fitness trackers, classic examples. Monitoring heart rate, steps, sleep, stress, activity. Some now do continuous glucose monitoring, CGMs. They turn your physical activity into digital data streams, offering convenience, personal wellness insights, that kind of thing. But it goes beyond watches. We're seeing things like smart shirts now. Shirts that collect a whole suite of physiological data. Blood pressure, ECG, heart rate, temperature, blood glucose, oxygen saturation, and then upload it straight to a health cloud. The idea there is comfort, real-time feedback, letting caregivers maybe step in earlier. Then you have more specialized wearables, like wearable seizure monitors, watches designed to alert a caregiver if they detect abnormal movement patterns, like with epilepsy. And in the neurotech space, we're seeing head-worn devices emerge. Some record brain activity, others actually stimulate the brain. For exercises, or maybe to help manage chronic pain or depression, it's pretty wild. There are even glasses, like from the Attentive You project, that track your attention span and give you feedback if you zone out. And don't forget hearables. These aren't just fancy hearing aids anymore. They connect to your smartphone assistant. Some can even detect if you fall down, way beyond just helping you hear better.
Okay, wearables are one thing. You can take them off, right? But then you get into devices inside our bodies. That feels like a totally different level of intimacy with the technology. How does that change the game, privacy-wise, security-wise, compared to a watch?
That's exactly where the stakes get higher. A wearable you can take off, well, it offers a certain kind of control, doesn't it? An implantable. You're talking 247 data streams. You can't just turn it off. It's inescapable. And the sheer invasiveness means any breach, any misuse, it becomes exponentially more personal, more damaging.
Which brings us to implantable or internal devices. We mentioned pacemakers already, and ICD's implantable cardioverter defibrillators. They provide real-time continuous heart data. But they also allow remote management now. Doctors checking battery status, lead impedance, other vitals, without you needing to come in. And the Ross Compton case, as we discussed, really throws a spotlight on the legal and ethical tangles that connectivity creates. Cochlear implants are another example. Newer ones connect wirelessly to smartphones. Users can monitor their hearing, adjust settings right from their phone. And it goes further. There are implantable smart stents being developed. They continuously monitor blood flow, trying to detect potential new clots early. Maybe one of the most intriguing, ingestible digital pills.
The FDA approved the first one back in 2017. It was an aripiprazole tablet that's a psychiatric medication with a tiny embedded sensor. It records when you actually swallow the pill. That data goes from the sensor to a wearable patch, then to a mobile app. So patients, caregivers, doctors, they can track medication adherence, which is a huge issue in some conditions. This tech is expanding. Potential for oral oncology drugs, tracking adherence, dosing, maybe even patient activity levels to fine-tune chemo regimens. We're also seeing concepts for really tiny body-implanted sensors, tissue-integrated biosensors for super precise biotracking, or even, get this, tooth-mounted RFID sensors to track your glucose, salt, alcohol intake. The level of granular data collection is just unprecedented, from smart shirts reading your vitals to pills you swallow tracking adherence. IoB turns our bodies into these constant data streams, like a biological ledger, every breath, every pill potentially recorded. Incredible insight, yes, but also incredible vulnerability.
And then there's a third category, right? Devices that aren't worn, not implanted, but they're in our environment and still interact with our bodies.
Exactly. These are the freestanding or ambient devices that interact with the body. Probably the best examples in healthcare right now are those sensor-equipped hospital beds. These aren't just beds, they're constantly tracking vital signs: temperature, heart rate, blood oxygen, pressure, even fluid intake, uploading it all to the electronic health records. This means healthcare providers get instantaneous remote monitoring. Alerts trigger for any sudden changes. It could really improve patient outcomes, potentially quite significantly. And, maybe surprisingly, internet-connected toilets are starting to emerge as IoB devices too, designed to collect various health data right from, well, biological samples. So yeah, from the wearables on our wrist to the implants inside us to the sensors in our environment, IoB is weaving itself into the very fabric of our lives, collecting data on a scale we've just never seen before.
Okay, it's clear the Internet of Bodies and medical IoT, which is closely related, they aren't just about tracking steps or sleep. They genuinely hold this immense potential to completely revolutionize healthcare. We're talking about a fundamental shift, aren't we? Moving away from that reactive, often one-size-fits-all model to something much more personalized, proactive, even preventative.
That's absolutely the core promise. These data streams from IoB devices, they're creating this incredibly rich source of user data for healthcare systems, a constant flow of information. And this flood of data allows for new discoveries, helps detect conditions much earlier, supports critical decision-making, all aimed at improving quality of life. And think about the need. We have an aging global population, right? Rising rates of chronic diseases like diabetes, heart disease. There's this urgent demand for better real-time healthcare systems. IoB provides that continuous data flow needed to meet the demand, to allow interventions before things become a crisis.
And a huge part of that promise lies in how these technologies improve patient monitoring and management, even when the patient isn't physically in the clinic or hospital.
Exactly. Remote patient monitoring is a perfect example. Continuous tracking of physiological data, maybe through wearable sensors like that MA PSS system using a smart shirt. It allows caregivers to step in really early if something is going wrong, and this data gets transmitted in real time. Using various wireless protocols, Bluetooth, Wi-Fi, Zigbee, GPRS, 3G, 4G, often using special MEC protocols designed to be super power efficient. Which is critical, right? These tiny sensors need to run for days, weeks maybe, without constant recharging. That makes true 24/7 monitoring actually feasible. Patients can be monitored wherever they are, giving this continuous window into their health status. And beyond just general monitoring, IoB is proving really transformative for chronic condition management. Think about diabetes. Advancements in artificial pancreas technology, which rely heavily on IoB sensors and pumps, are leading to much better glycemic control for patients, or heart conditions. The FDA has approved smartwatches that can track atrial fibrillation, AFib. They alert patients when they might need to see their doctor. In fact, there was a study by the Center of Connected Health Policy. They found remote monitoring of heart failure patients using IoB devices cut 30-day hospital readmissions by 50%. 50! That's huge! And it's mostly down to that early detection and intervention made possible by continuous monitoring. Another really crucial application is outpatient treatment adherence. We talked about those digital pills. They're not just theory. That FDA-approved aripiprazole pill for psychiatric disorders, it gives clear proof of when medication is taken. Similarly, digital sensors in oral oncology drugs are being developed to track adherence, yes, but also dosing, maybe even activity levels, to help tailor chemotherapy better. These insights really change how providers can support remote care and potentially improve how well patients respond to treatment. Even in image-based diagnosis, we're seeing mobile devices used for real-time interpretation of radiology scans, MRIs, CT scans. Now, conventional workstations are still the gold standard, definitely, but studies are showing pretty good diagnostic agreement in many cases, which could mean faster diagnoses, even with some limitations currently in the mobile viewer tools.
So it's not just helping patients manage things at home. IoB is also making care inside the hospital itself better.
Absolutely. Inpatient care is getting significantly more efficient and safer thanks to IoB. Take smart infusion pumps. You know, the machines that deliver IV fluids and medications. Newer ones already have dose error reduction systems built in. They integrate medication databases. They automate alarms if something's programmed incorrectly. But the next logical step, and it's already happening in places, is direct transmission of doctors' orders. Right from the electronic health record, the EHR, straight to the pump, ensuring the correct rates, the correct dosages, potentially cutting down medication errors dramatically. And similarly, those sensor-equipped hospital beds we mentioned, they're transforming continuous monitoring on the ward, tracking vitals constantly, temperature, heart rate, blood oxygen, pressure, fluid intake, all uploaded straight to the EHR. Staff get instant remote visibility. An alert goes off immediately if a patient's status changes suddenly. This kind of continuous, non-invasive monitoring. It's been shown to improve patient outcomes and actually reduce time spent in critical care, which is a massive win for patients and for strained healthcare systems.
And thinking bigger picture, beyond individual patients, IoB seems like it could have a pretty major impact on broader public health efforts, too.
That's a really critical point. IoB could revolutionize disease surveillance. Imagine sensors in smartphones, wearables, maybe even built into public facilities, toilets, door handles, all working together, detecting disease presence, tracking its spread through a population in near real time. This capability could be invaluable for tackling epidemics, pandemics. There was a great example related to the Zika virus outbreak. Researchers proposed this system using IoT sensors, cloud computing, mobile phones. It used phone GPS to track people's locations, mosquito sensors to find breeding sites in risky areas, then sent alerts to uninfected people and flagged areas for government action, like immediate action. And crucially, this kind of surveillance can help identify silent carriers, people who are infected but don't have symptoms, which is vital for understanding the true spread of a disease. And this flows right into the idea of precision public health, using all this IoB data, person-generated health data, EHRs, maybe even genetic data to uncover really complex links between individual behaviors, demographics, population-level factors. This allows for highly targeted precision interventions. Not just blanket advice, but tailored approaches to combat health disparities. For instance, if you can understand precisely how diet, lifestyle, stress levels correlate with health outcomes in specific communities, public health can move beyond that one-size-fits-all approach, address the unique needs of different groups much more effectively. Of course, all these amazing advancements, from personalized medicine right through to real-time disease surveillance, they all hinge on having sophisticated, reliable medical devices and critically secure ways to handle all that data. This is exactly why specialized solutions focusing on the risks and security are so essential, like those offered by our sponsors, www.devicerisk.health and www.hippiesecurity.health. They're crucial for unlocking the full potential here.
Yeah, really brings it home. Improving the device risk side of things, making sure hypersecurity is rock solid. It's not just an IT issue. It translates directly into better, safer, more efficient care for absolutely everyone. Okay, let's shift gears a bit and dive into another really mind-bending concept that's emerging in healthcare. The human body digital twin. Now, a lot of us might have heard of digital twins, anastoxiful, like manufacturing or engineering, right? Or a virtual copy of a jet engine, maybe, or a whole factory floor, used for simulation, optimization. But applying that same idea to the human body, it sounds like pure science fiction.
It definitely has that futuristic ring to it, but it's very much a reality that's advancing incredibly quickly. A human body digital twin, or DT, is basically just that, a virtual representation of an individual person's physiological state. It's built using real-time data, streaming in from loads of sources, sensors, wearables, medical tests, all feeding into this virtual model. And the core purpose, to simulate, predict, and ultimately optimize health outcomes. Using advanced analytics, sophisticated simulations running on this virtual you, this technology really could revolutionize not just healthcare treatment, but also overall wellness and prevention, moving us from reacting to illness to proactively managing health on an individual level.
Building something that complex, a virtual model of a whole person, it sounds like it would need a very, very structured approach. Is there like a roadmap for this?
There is, thankfully, and it's pretty crucial for guiding development in such a complex field. One of our sources from Archive details this proposed 5-level roadmap specifically for human body digital twins. It guides the whole process, from the basic building blocks up to really sophisticated models. So here's how it breaks down roughly. Level 1 starts with the sensing components, mostly wearable devices, collecting that initial raw data. Level 2. Then, data collection, gathering all that information from sensors, maybe other sources too. Level 3, analysis. This is where the raw data gets processed, interpreted, turned into meaningful insights. Level 4, decision-making systems. Using that analyzed data to actually inform clinical decisions or make personalized recommendations. And finally, level 5. This leads to what they call explainable models, which is super important. It means the digital twin doesn't just spit out a black box prediction like, oh, you're at risk. It can actually tell your doctor why. Like, based on these specific physiological changes, this history, we predict this outcome because of these clear factors. That transparency. Absolutely vital for clinical trust in getting this widely adopted, this whole structured framework, this roadmap. It's really important. It helps create a common language across different fields, engineering, medicine, data science, and that really helps facilitate the kind of interdisciplinary collaboration you absolutely need for something this ambitious.
That roadmap makes sense, shows the progression. But what about right now? Are there cutting-edge applications of these digital twins actually being used in medicine today? Where are they making a real difference?
Oh, absolutely. What's really striking is how diverse the applications already are, even at this relatively early stage. Take personalized cardiology at Johns Hopkins. There's pioneering work there by researcher Natalia Troyanova. Her team creates personalized digital twins of a patient's actual heart geometry. This isn't some generic model. It incorporates specific disease remodeling, damage, fibrosis, inflammation, all mapped out using MRI or PE scans. And even more impressively, it models how electrical waves actually propagate within that unique heart. Now, why is that level of detail useful? It allows them to precisely predict where arrhythmias are likely to originate, where those abnormal electrical waves start swirling around because of scar tissue. Knowing that, they can then figure out the optimal treatment plan, like exactly where a catheter should be placed during an ablation procedure to stop the arrhythmia. This work was genuinely groundbreaking. First digital twin in cardiology approved by the FDA, first digital twin approach used in a randomized clinical trial. And building these intricate heart models, it takes immense computing power, sophisticated AI, neural networks learning patterns from scans, machine learning predicting arrhythmia origins. It's like creating a digital heart specialist. And then there's a completely different application from the Cleveland Clinic focused on improving health equity. They're using digital twins to understand how a patient's neighborhood actually influences their health outcomes, which is fascinating. Their twins are built using a really rich mix of data, electronic health records, but also environmental characteristics of neighborhoods, socioeconomic factors, public data. And the goal is profound. Use these insights to inform population health planning, to actively try and decrease those location-based health disparities. Because it's a sobering fact, right? Life expectancy can vary by as much as 25 years just based on where you live. This approach offers a powerful tool to start tackling those kinds of systemic inequities.
Those are incredible examples. It's mind-blowing, really. So looking ahead, what's next? What are the future prospects and maybe the challenges for human-body digital twins?
Well, connecting it back to the bigger picture, a lot of the challenges boil down to scalability and integration. That cardiac twin at Johns Hopkins still takes 3 or 4 days to create one. So the future needs to speed that up dramatically, make it more portable, and integrate these individual twins with larger systems, maybe even digital twin cities like the one Singapore is building. That points towards needing continuous, innovative engineering effort. Digital twins are also going to be huge for engineering better devices in the first place. Imagine creating a digital twin of an embedded medical device like an insulin pump or a pacemaker while it's in the patient. To understand its current state, optimize its performance, manage it better, or even broader. Imagine engineering and running full product tests for new medical devices entirely in a virtual environment before you even build a physical prototype. That could drastically speed up development, improve safety through much more rigorous virtual stress testing. But, and this is a crucial but, we have to stress the underlying reliance of all digital twins. Doesn't matter if it's for personalized medicine, public health, device engineering. These digital replicas depend totally on vast amounts of high-quality data. Data from sensors, scans, medical records, insurance claims, genomic data, you name it. Without that constant, reliable, high-quality data feed, the digital twin is just a cool concept. It's the data that makes it a powerful predictive tool.
It's just undeniable the potential here is groundbreaking. But like any really powerful technology, there have got to be inherent risks that need super careful management, which is why resources focused specifically on that challenge are so incredibly valuable.
Absolutely. Making sure human body digital twins are implemented responsibly, effectively. It means tackling the crucial security issues, the cost barriers, the ethical considerations head on. Our sponsor, www.digitalwinrisk.health, is deeply committed to navigating exactly these complex layers, ensuring the integrity, the safety of these virtual versions of ourselves.
Okay, we've spent some time on the incredible promise, the exciting future of IoB and digital twins, but now we have to turn to the alarming underbelly. Because these technologies, as transformative as they are, they definitely come with some significant dangers lurking just beneath the surface, especially when we talk cybersecurity, privacy, and ethics. Let's start with the raw peril of cyber attacks.
Right. And for anyone familiar with cybersecurity, you know the classic CIA triad. Confidentiality, integrity, availability. Keep data secret, accurate, and accessible when needed. But with IoB, compromising any of those doesn't just mean, data loss or system downtime like in other industries. Here, it can mean immediate life-threatening harm to a patient or profound, irreversible invasions of privacy. IoB tech suffers from the same kinds of attack vectors as other IoT devices, sure, but the risks are just enhanced. Because of that direct connection to the body, because of the incredibly sensitive nature of the data, any failure in confidentiality, integrity, or availability in healthcare, the consequences can be severe and immediate. And history already gives us some pretty stark warnings about medical device hacking. Back in 2019, the FDA announced a voluntary recall for certain Medtronic MiniMed insulin pumps. Older models pre-2013. Why? Cybersecurity risks. Now, no actual harm was reported, thankfully, but the risk was huge. A hacker wirelessly could connect to a nearby pump and change settings, leading to potentially fatal outcomes. Too much insulin causing hypoglycemia, or stopping insulin leading to ketoacidosis. Serious stuff. Serious enough for a recall. And we've had concerns about implantable cardiac devices for years. Pacemakers, defibrillators, vulnerabilities in their wireless communication could let someone manipulate data, maybe even insert malicious commands. It was widely reported that doctors actually disabled the wireless functions in Vice President Dick Cheney's pacemaker, specifically because of these hacking fears. That tells you the level of concern, right? Plus, there had been documented cases of infusion pumps getting infected with malware and delivering the wrong medication doses, directly putting patients at risk. And it's not just the devices patients wear or have implanted. Even hospital infrastructure is vulnerable. In 2021, these critical vulnerabilities called Poon and Piper were found in pneumatic tube systems, those tubes that zip samples around hospitals. These systems are used in thousands of hospitals worldwide, over 80% in North America, and the vulnerabilities could let attackers take over the stations, maybe launch ransomware attacks. Imagine holding a hospital's entire internal transport system hostage. And beyond specific devices or systems, the wider hospital system vulnerabilities are a massive, massive concern. Ransomware attacks, they're increasingly targeting vulnerable remote access systems in healthcare. And the consequences are just devastating. Hospitals crippled, vital medical records held hostage. Treatment plans thrown into chaos, emergency vehicles diverted, appointments canceled. Sometimes entire facilities have to shut down. ECRI, the Patient Safety Organization, they've been warning about healthcare cybersecurity since 2018, and they say the problem has only gotten worse. These attacks aren't just about money. They cost lives by disrupting critical care when people need it most. We've even seen things like X-ray machines sending unencrypted patient diagnoses over the internet, or MRI scanners found communicating with unauthorized control centers, reportedly in places like Russia. It just highlights this incredibly complex ecosystem. You go from the physical device on or in your body to maybe a monitoring device like your smartphone, then up to a cloud service. Each step, each layer adds complexity, and each layer is a potential point of failure or a target for attack.
The thought of hackers messing with a hospital's systems is terrifying enough. But when it's your own body generating the data, the privacy implications feel so much more personal. Can you really articulate that difference? What makes an IoB data breach different from, say, losing your credit card number?
That's a really important distinction to make. A typical data breach, maybe your credit card number gets exposed. That's bad, obviously, annoying. But it's replaceable, right? You get a new card. A breach of IoB data, that potentially exposes your biological blueprint, your most intimate bodily functions, your movements, maybe even down the line, your thoughts. It begs the critical question, who actually has the authority to use this incredibly intimate data and how? IoB devices collect stuff that's just immensely personal, our exact whereabouts, moment by moment sometimes. Intricate bodily functions, what we see, what we hear, the intimacy is just unprecedented. And the law enforcement and legal precedent angle is particularly chilling. That Ross Compton pacemaker case we started with, it's such a stark reminder. Deeply personal medical data being used in a criminal investigation, raising fundamental constitutional questions. Fifth Amendment, self-incrimination. Fourth Amendment, unreasonable search and seizure. There are also real concerns about these things called data fusion centers, places that aggregate personal and health data from tons of public and private sources. One source warned this could give law enforcement nearly omniscient knowledge over the individuals they choose to surveil. That's a scary thought. Then there's this concept of data endurance. Think of your health data having its own kind of afterlife. Results from a genetic test today, or data from an IoB medical device. Maybe it identifies you as a carrier for a certain condition. Theoretically, decades from now, could that data be used to deny insurance coverage or maybe other benefits to your grandchildren? It's sobering. Your digital health footprint could become this sort of inherited liability. And on top of that, there's a serious risk of bias in algorithms and data interpretation. The data coming from IoB devices and the algorithms crunching that data, they can be biased. They can be harmful, especially if there's no transparency about how they work. This is a big worry given the problem of input bias, who uses these devices in the first place. And the fact that clinical data historically hasn't been very representative, often collected from, middle class, upper class, younger, white male participants. If the underlying data is biased, the insights you get from it will be biased too, potentially making health disparities even worse, not better.
So beyond the direct cyber threats, the direct privacy breaches, these technologies also bring up these bigger, maybe fuzzier ethical and societal challenges. Manipulation, equity, control. It really makes you think, doesn't it? Where is that line between helpful health tracking and just losing yourself to constant data harvesting?
That's such a crucial point, and this is where that Internet of Behavior idea really bites. How IoB can subtly predict and maybe even influence our actions. Think about behavioral manipulation and consent. Social media algorithms, we know they track everything like shares, how long you look at something to keep you engaged, but they also subtly nudge your behavior, right? Encouraging purchases, shaping opinions, maybe even influencing your mood. Online shopping, finance apps, they track your clicks, your purchases, how long you linger on a product page, all to target ads and influence your future spending. Health and wellness marketing, using your biometric data, heart rate, sleep patterns, stress levels to suggest products or services. And then there's gamification, turning everyday tasks into games. Fitness apps with badges, loyalty programs, using positive reinforcement to shape your behavior, often without you fully realizing how it's working or giving truly informed consent. The issue of transparency and loss of control is huge here. So many IoB systems just hum away quietly in the background collecting data. We click agree on those long terms of service, but do we really grasp how our data will be used? How it's being leveraged to subtly shape our choices, this lack of transparency. It can easily slide into what's called manipulative design, where systems nudge you, guide you, without your informed consent. Shifting from being helpful to potentially being exploitative. And this also brings up major worries about equity and access disparities. These advanced IoB technologies, they're often expensive. They contribute to rising healthcare costs overall. This could easily make health disparities worse, creating bigger gaps for people without reliable internet, without the financial means, maybe without the tech skills to use these devices effectively. You risk creating this two-tiered system where the best, most proactive care is only available to a privileged few. And finally, there are some really serious implications around forcible adoption and surveillance. You can imagine scenarios where IoB tech gets mandated, especially in the criminal justice system. Think about IoB-enabled ankle bracelets for location monitoring, or maybe digital pills replacing court-ordered psychiatric treatment monitoring. Raises huge questions about autonomy, dignity, and on a bigger scale, surveillance concerns are real. Emotional sensors picking up moods. Foreign adversaries potentially compiling incredibly detailed profiles on populations. Remember the Anthem hack in 2015? Chinese actors indicted for stealing 80 million U.S. health records. And reports suggest China has broad access to U.S. clinical and genetic data through various investments and partnerships. These aren't just abstract threats. They represent a significant national security risk stemming from the very personal data collected by these devices we're increasingly relying on.
Yeah, these risks, they're not theoretical anymore, are they? They are present, they are growing.
Yeah.
And just understanding them feels like the absolutely critical first step towards protecting ourselves.
Indeed. And the challenges are complex, operating on so many levels. From the security of the individual device to the overarching data security frameworks, right down to the very concept of digital identity when it's tied to our biology. This is where specialized expertise becomes not just valuable, but absolutely vital. Expertise in areas like medical device risk, IPA compliance, digital twin security, the very things highlighted by our sponsors, www.devicerisk.health, www.hapasecurity.health, and www.digitalwinrisk.health. It's crucial for patient safety and privacy moving forward.
Okay, the potential risks of the Internet of Bodies, medical IoT, digital twins, they're clearly profound. So what can we actually do about it? How do we protect ourselves, protect our data in this rapidly connecting world? Where do we even start building a more secure, more ethical IoB future?
That really is the multi-trillion-dollar question, isn't it? And the answer isn't simple. It's got to be a multifaceted approach. But a big piece starts with manufacturer responsibility. Device makers simply have to be more proactive. They need to rigorously review the cybersecurity of products already out there in the market, provide timely software patches, updates, and they need to adhere to standards, like the DTSEC cybersecurity standard, which was developed with input from the FDA. The FDA itself has pre-market cybersecurity guidance since 2018, actually, emphasizing trustworthy design from the start, providing a cybersecurity bill of materials so users know what's inside, ensuring devices can be patched, having clear labeling. This kind of proactive security, baked in from design through post-market support, it's absolutely paramount. It can't be an afterthought. But it's not just on the manufacturers. Healthcare providers have a huge role to play in adopting best practices. ECRI, that patient safety organization, they have some really clear recommendations. Things like secure your internet-facing systems, your remote access points, VPNs, and apply the security updates diligently. They advise routinely scanning your perimeter networks for vulnerabilities. And CISA, the Cybersecurity and Infrastructure Security Agency, actually offers free scanning services for health organizations. No excuse not to do it. Providers should also audit their systems against CISA's known exploited vulnerabilities catalog, the KEV list, and prioritize fixing anything found there immediately. It might even be wise, ECRI suggests, to consider blocking network traffic from potentially adversarial countries if your organization doesn't actually do business there. What else? Routinely audit logs and traffic coming from those remote access systems. Don't ignore the basics like phishing attacks and password compromises. Those are still huge entry points. And crucially, maintain robust backup and recovery methods for all your IT systems. And periodically test restoring from those backups. Don't just assume they work. Finally, develop comprehensive incident response plans, specifically including contingencies for ransomware. That means having clear policies for diverting patients if needed, establish downtime procedures for operating without the electronic medical records or other network systems, ensuring patient care can actually continue safely even during a major cyber attack. Then there's the vital role of industry collaboration. We need environments where security researchers feel safe disclosing vulnerabilities. Public-private partnerships, like the Medical Device Innovation Consortium, are helping foster this, making it easier to share vulnerability info without fear of prosecution. That encourages transparency, gets fixes out faster. There's also a really cool grassroots effort called I Am the Cavalry. They developed a sort of Hippocratic oath for connected medical devices. It promotes 5 voluntary principles for providers and manufacturers, focusing on making devices resilient against intrusion, tampering, unauthorized disclosure, and ensuring updates and fixes are prompt and effective, building that culture of shared responsibility.
It really does sound like a bit of a Wild West scenario when it comes to actual regulation, though. What's happening on the policy front? Is anyone trying to bring some order to this rapidly expanding universe of connected health tech?
You're right to call it fragmented. The current governance landscape is very much a patchwork. You've got a mix of direct and indirect oversight from different state and federal agencies. FDA, sure, but also the Consumer Product Safety Commission, CPSC, the Federal Trade Commission, FTC, NIST setting standards. The challenge is these agencies often work within their traditional mandates, their traditional silos, which can leave significant gaps in comprehensive oversight, specifically for IoB devices that blur those lines. And a really important point to grasp here is IPA's limitations. We all think of HIPAA as the health privacy law in the U.S., and it is critical for protecting medical information held by covered entities, doctors, hospitals, insurance plans. And this is huge, but IPAA does not cover most of the non-medical health or biometric data collected by tons of consumer IoT devices. Your fitness tracker, your wellness app, that data often falls outside IPAA's scope. This leaves a massive amount of highly personal data, largely unregulated at the federal level, creating really significant privacy vulnerabilities for consumers. So in the absence of strong federal action, we're seeing emerging state laws trying to fill the void. States like Illinois, Texas, Washington, they have passed laws specifically regulating how companies can capture or use biometric information, often requiring explicit consent. And then there's California CCPA, the California Consumer Privacy Act, which went into effect in 2020. It gives consumers much broader rights over their personal data. The right to know what's collected, why, who it's shared with, the right to opt out of data sales, even the right to request deletion. And importantly, CCPA defines personal data very broadly. It includes biometrics, geolocation, even those inferences used to build psychological profiles about you. We're seeing other states drafting similar laws to at least 8 others last I checked. It shows this growing recognition that the current federal framework just isn't enough for the IoB era. Ultimately, though, if you connect this to the bigger picture, there's a clear and growing call for federal standards. Many argue Congress really needs to step up. Consider establishing comprehensive federal data transparency and protection standards, specifically for IoB data. We can definitely learn from regulations like Europe's GDPR or California's CCPA, especially around giving users clear rights, like the right to opt out of data collection altogether. We also probably need stronger regulations for data brokers, those companies that just collect and sell personal information, and much clearer restrictions on who can collect IoB data in the first place, how they can use it, and whether they can sell it to third parties.
Okay, so given this complex picture that means manufacturers needing to do better, providers needing best practices, regulators kind of catching up, what can we do as individuals, as users, as consumers? How can we protect ourselves and safeguard our own privacy in this world that's getting more connected by the minute?
That's a great question, because while regulators and companies have huge responsibilities, individuals aren't powerless. There are absolutely actionable steps you can take. First off, really adjust your privacy settings on your devices, on your apps. Systematically go through them. Disable activity tracking where you don't need it. Turn off background data sharing for apps not actively in use. Be stingy with permissions, location, microphone, camera, especially for apps that don't have a genuine need for them. A really strong recommendation. Use messaging apps that offer end-to-end encryption. And try to avoid signing into apps using third-party accounts like your Google or Facebook login that often creates expensive data sharing linkages you might not want. You can also gain significant control simply by choosing privacy-focused tools. Your standard web browser, your standard search engine, they're often tracking your activity extensively for targeted ads. Instead, consider switching. Use privacy-focused browsers like Firefox or LibreWolf, which block many trackers by default. Use search engines like DuckDuckGo, which don't log your search history or build a profile on you. That significantly reduces the behavioral tracking footprint you leave online. Another really important tool in your arsenal is a virtual private network, or VPN. A VPN does two key things. It hides your real IP address, making it harder to link your online activity back to your physical location. And it encrypts all the traffic between your device and the internet. This makes it much harder for third parties like your internet service provider or anyone snooping on public Wi-Fi to see what you're doing online. And it prevents your ISP from easily logging or selling your browsing habits. But it's important to remember, a VPN doesn't stop tracking by the platforms you're logged into. Facebook, Google, if you're logged in, they can still track your activity across their services, VPN or not. We also just need a greater degree of behavioral awareness. Think about it. Every little action online, a like, a comment, checking in somewhere, reveals patterns, habits, maybe even emotions. Be mindful of what you post, what you click. Over time, this data builds a behavioral profile of you that can be far more detailed than you'd ever imagine. So really just think before you share. Being intentional about your digital interactions is one of the simplest but most powerful ways to limit how much of yourself you're inadvertently giving away. It's also really vital to understand terms and policy updates. Yeah, nobody likes reading them, but when an app updates, take a quick look at the privacy policy changes. Are they collecting new types of data, using it in new ways? Companies sometimes quietly expand data collection through these updates. Staying alert gives you the chance to adjust your settings or maybe even stop using the service if you're uncomfortable. And finally, regularly clean up your digital footprint. Delete apps you don't use anymore. Clear your browsing history periodically. Close old online accounts you've abandoned. This helps reduce the amount of your past activity that's just sitting out there, potentially accessible, potentially feeding into behavioral tracking models. But at the end of the day, consumers really need to proceed with a healthy dose of caution. Consumer vigilance is key. Assume, as a default, that once your data is collected by an IoB device, you might not have complete control over where it goes, how it's stored, or how it's used. Be prepared for the possibility that it could be breached, or maybe shared in ways you didn't anticipate. Just having increased awareness of this whole IoB ecosystem and the risks involved is absolutely critical for navigating this new frontier safely. The responsibility really does fall on everyone: manufacturers, healthcare providers, policymakers, and absolutely individuals too. The good news, though, is that there are dedicated entities working on providing the solutions we need.
Yeah, whether it's tackling those device vulnerabilities head on, ensuring data privacy meets modern challenges, or managing the really complex risks that come with these digital models of ourselves. Comprehensive security is just paramount. We absolutely appreciate the critical work being done by our partners at www.devicerisk.health, www.hackasecurity.health, and www.digitalwinrisk.health in helping make this connected future safer and more secure for all of us. Hashtag outro. Well, we have journeyed deep today into this fascinating, incredibly complex, and sometimes unsettling world of the Internet of Bodies, medical IoT, and human body digital twins. We started with that remarkable promise, didn't we? Personalized medicine, virtual replicas of ourselves, potentially revolutionizing healthcare as we know it. But we also had to squarely face the stark realities, those ever-present threats of cyber breaches, the profound privacy invasions, the really thorny ethical dilemmas that all this connectivity brings to the surface.
Yeah, this deep dive really underscores that IoB isn't just another tech advancement. It feels more fundamental than that. It's shifting our relationship with our own bodies, with our data, and honestly, with each other. It's redefining what connected means and what it means to have this digital presence that's so intricately biologically tied to our physical selves.
So the big question left hanging maybe, as our bodies become more and more intertwined with the internet, as these virtual replicas of ourselves start to emerge, how do we make absolutely sure that this profound connectivity serves to empower us rather than control us?
Exactly. The question isn't really whether the Internet of Bodies will change everything. It probably will. The real question is whether we as a society are ready and proactive enough to actually shape that change, to shape it in a way that truly benefits human dignity, autonomy, and well-being, especially as these technologies get even more sophisticated, even more woven into the fabric of our lives, even more ubiquitous. It's a question we all really need to keep thinking about as this future unfolds.